As COVID-19 numbers in Gauteng continue to rise, now at over 63,000. How and where is this virus spreading? To help us unpack what the current data shows, I'm joined by the chairperson of Data Science and a senior lecturer at the University of Pretoria, Dr. Vukosi Marivate. Dr. Vukosi, good evening and thank you for your time tonight. When you talk of modeling a pandemic of this nature, what are the complexities that go into it?
Evening, Tabo. Biggest challenges that we have with looking at data and then also doing modeling is that the numbers that you get on a daily basis don't tell the full story. So yes, we have some information about the number of cases that have been tested positive, given the tests that have gone on and also the deaths. But then with each of those numbers, there's a lot of assumptions that you're making or also things that you can't see. So one of the things that you need to take into account is that testing has a lag. I think at the moment, as per the NICD, we are down to about on average maximum about 5 days between a sample being taken and then the test result actually getting back to somebody. Also, you might have seen now that Gauteng has not reported deaths for 2 days, and they've and some of that reasoning is just that it takes a little bit of time to also just make sure you tabulate and you get the data right before it gets reported as an official stat. So it doesn't mean that when the numbers come out, I think tomorrow or tonight, about the deaths in Gauteng, I think the MEC had said earlier that the numbers will be coming out. They have submitted them. That number is not just about today, but it might be for the last few days as well. So now when you build in models such as the MEC and Premier have been talking about earlier, the models need to use that information. So now you can see that one part also has some uncertainty. On top of that, you also need to understand that models need to take into account what's actually going on the ground. A lot of the models earlier that were available had been assuming that we're on lockdown level 5 and lockdown level 4, but then now people have gone back to work. People are traveling. Some types of kind of gatherings are allowed, and all of that changes the variables inside the models. Yep. So because of that, then you have adjustments that need to be made to the models.
We are seeing an exponential increase, though, in terms of the cases as we are relaxing the restrictions. How does that impact on the modeling?
So with the data, what's actually telling us now that with the relaxation has allowed people to move around more, right? The the virus gets transmitted from person to person, right? So what happens that if you're in a specific area, and you're with other people, and then somebody might be positive, then through your, it's a respiratory tract, you then get the virus if somebody else is. So now people are going back to work. In South Africa, this means that people are taking more and more public transport. We've had the challenges now that loading of some specific types of transport now is at 100%. You are sitting in a place for a extended period of time. There's a higher chance now that you actually contract the disease. Then you're at work and you're also with other people longer period of times. Then you might actually contract the disease. Then you move on to some people breaking regulations and people meeting family, people meeting friends. All these gatherings increase the chances actually of transmission. So during the hard lockdown level 5, it's just that most of us now were really put in this point where you couldn't really move, and then the numbers could be suppressed a little. It wasn't that we were going to completely have no numbers. We knew that we were going to grow. It's just that we were trying to slow down that growth as much as possible. Want to get our health facilities ready, but then at the same time understand kind of the dynamics. Unfortunately, we can't have very onerous lockdowns forever, just because we also have our social challenges in the country and also economic challenges that also do turn into social challenges for some, that some people had to go back to work in a way.
So the transmission dynamics, though, have changed in such a way that the pandemic is now increasing beyond the projected or the expected rate of increase. And what does this then say to us? Because, as you mentioned, the drivers of transmission have now shifted. How do we reassess our methods of control? Do we go back to a hard lockdown?
I think, in my opinion, we need to still, again, take care of the basics here. So we need to reduce the amount of movement, and this takes into account multiple things. It's not just government doing something, but then also us as society and the private sector. If you can have, for example, an employer being able to make sure that most of their employees who don't really need to be in an office, right? It doesn't mean if you're not sitting in office means you're not working. You can be productive at home in a lot of jobs. Not all, but a lot of jobs can actually move into trying to make sure that they allow their employees to work from home. As such, it doesn't necessitate any travel, no public transport, and then also time people spending time and being in one space for a long period of time. That is one thing. I think a lot of what the provinces are trying to do is trying to think about ways they can adjust the way we live in such a way that it reduces movement and chances of people being in specific places. I think I saw that Gauteng might be trying to reduce the amount of people allowed at a funeral from 50 to 20. Right. And then again, reducing the amount of people in the public transport, to not be 100% loaded. All of this is trying to put in non-pharmaceutical interventions. Meaning you're trying to fight the disease without there's no medication, there's no, there's no cure at the moment, and also we don't have a vaccine. So you need to find these other ways to slow it down in such a way that you reduce the amount of people who are ending up in hospital and the people who might need oxygen, ultimately who might need to then be on a ventilator. All of these things now are under pressure. And that's one of the things now that we need to be very open about as a country is what is the capacity and capability that we have in our health systems entirely, meaning that it really is my suggestion for all provinces on a daily basis to be able to update on here's how many beds are left. Here's how many, how our human resource means of in terms of health professionals, whether it's nurses or doctors, are available, and how many of them have gotten sick, and how many have had to then stop. All of these are pieces of information that are really important in decision making, and also brings the public into the confidence of the government in terms of what's going on, and also knowing actually what what actually changes might be made in places where you might have hospitals that are inaccessible because they're at 100% occupancy at the moment.
Is this information that's available to the public, or is this information that is going to have to be given to the public by the department?
So at the moment, you find that the departments of health, whether provincial or national, they do provide their somewhat on a daily basis what the number of hospitalizations are, what the ICU numbers are as per such, but they're not giving information in terms of, hey, this hospital, here's where we are. Why is this important? You can quickly triage what's going on in a specific area. So if you have a specific region that's really under pressure, we might know this from looking at the districts and sub-districts, you then should expect that after a while, those cases that you see as numbers now start overwhelming the hospitals around that area. And then there is responsibilities that we have to take personally, and there's responsibilities that also government has on actually trying to make sure that these facilities try to function at maximum, and if they can't, you have to then divert the cases that are supposed to go there into other places. So in Gauteng, you have the Newzroom facility in Western Cape, you have the Cape Town International Convention Center. They have been prepared for this, and the International Convention Center in Cape Town is already having patients in there, while Newzroom is now gearing up for the numbers of people coming in.
Yeah. Is there anything that the health system can do to increase the recovery rate of active cases? One of the concerns in Gauteng now is that we have the highest number of active cases as compared to those who are recovering.
That unfortunately is outside my expertise, so there it will be bringing in doctors and more public health officials in terms of trying to think about where that can go. It is an important, to look at active cases, but then also looking at the patterns, on the hospitalization rates. So one of the things that you would have seen with Gauteng at the moment, we still have a somewhat low mortality rate. So how many people are actually dying after they've been actually tested positive is still very low comparatively. We are trying to, nationally stick to about between 1.5 and 2% mortality, but Gauteng is still, I think, close to 1. And then Western Cape is still a little bit high, around 4. So we're still trying to understand, what actually this might mean. And being on the advisory council in Gauteng, this is a thing that's bringing together people who are doing modeling, data analysis, as well as clinicians to try and understand these dynamics that are very important in understanding where we're actually going to go in the next few weeks.